Our conversation this morning on NTV Today, and it is something that most people are living with. Others don't even know they're living with, others who do not understand it. And I'm talking about Polycystic Ovary Syndrome. It is abbreviated as PCOS, and if we can put on screen that graphic to just enlighten you on what we're talking about. Polycystic Ovary Syndrome, it is a hormonal disorder causing enlarged ovaries with small cysts on the outer edges, and the causes, for some they say it's not very clear, but it's attributed to a combination of genetic and environmental factors. Now, the symptoms of PCOS: menstrual irregularity, excess hair growth, acne, obesity, etc. And I put on etc. there because it manifests differently in different people, and we shall be getting to know more about it. The symptoms, or rather the PCOS, by the way, you need to keep in mind is that it's very hard to diagnose because, as I said, the symptoms vary from one person to another. Now, the thing about this syndrome is that it can be managed by treatment, but it cannot be cured. So our conversation today to do with Polycystic Ovary Syndrome, and it is abbreviated as PCOS, and to just give us an idea of what it is and also those that are living with it, in studio with me I have Dr. Wanyoike Gichuhi. He is a gynecologist. Thank you for your time, Dr. And of course Beatrice Kathure, who is living with PCOS. Thank you for your time. Now, Dr. let's start first off. The fact that so far it seems that no one seems to understand why PCOS comes around. From your experience, what would you attribute it to?
No, it's not clear. It's not well understood, the polycystic ovarian syndrome. I mean, the first mention of polycystic ovarian syndrome was in 1939. And up to today, we still don't understand what causes polycystic ovarian syndrome. A syndrome is a collection of clinical entities which put together, then they put up that particular syndrome. Like polycystic ovarian syndrome, as correctly said, it will involve abnormal menses. Most of the time, the ladies will not have menses up to 3 months. Mm-hmm. And it may manifest in infertility. That's why most of the time we get it, because of infertility. And again, hirsutism, which is increased hair growth, mm-hmm. may cause acne, may associated with obesity at the same time. Mm-hmm. So it's a combination of several factors. And when you do hormonal profile, you find there's increased male hormone among the females. Mm-hmm. Yeah. So it's not well understood up to today. There are various diagnostics criteria which have been proposed, but the most we use is what we call Rotterdam criteria, which consists any of the three syndromes. That is symptoms. That is the missing periods up to 3 months, or unable to ovulate, and increased in male hormones, or increased in hair growth. And of course, with the ultrasound, you get polycystic ovary, as correctly said, many cysts. What I'd like to clarify and emphasize, an ultrasound showing polycystic ovaries does not mean someone has polycystic ovarian syndrome. Mm. There are factors: missing the periods, hair growth, failure to ovulate, infertility must also be there.
We're talking about Polycystic Ovary Syndrome. PCOS is how it is abbreviated. It is something that is very interesting and can be very slippery in terms of how it is diagnosed, because a lot of people misdiagnose it to be something else. But we're trying to understand it this morning, and to help us do so, we have Dr. Wanyoike Gichuhi. He is a gynecologist, and Beatrice Kathure, who is living with PCOS. Now, before we crossed over to the coast, Dr. you were clarifying on something, that the fact that you can have polycystic ovaries does not necessarily mean that you have PCOS. Explain that.
What I'd like to explain is polycystic ovarian syndrome. Syndrome is a clinical entity which contains different factors put together. Mm-hmm. It's not one single factor. It's not the way you can say somebody has malaria, therefore he has malaria protozoa there, it is there. What polycystic ovarian syndrome is a combination of several factors. Polycystic ovaries is just one of the clinical entities that we encounter. You
so
need also
I
yeah.
guess let's break it down.
Yeah,
What
yeah.
is a polycystic ovary to start with?
Polycystic ovary is an enlarged ovary with multiple cysts, at least 12 of them, which will be 3 to 4 millimeters, very small cysts that you get there. So if you do your ultrasound, you can get polycystic ovaries. But that does not necessarily mean that someone has polycystic ovarian syndrome. Is one of the entities you put together. You need to have polycystic ovaries, then you need to have an ovulatory cycles where you're not producing the egg, which manifests myself by missing your periods for at least 3 months. So if there's polycystic ovaries and somebody is missing her periods for 3 months, then you can say they have polycystic ovarian syndrome. Or the other clinical entity is there's increased hair growth. There are polycystic ovaries and there are a lot of hair growth, what we call hirsutism. You have seen ladies who will have beards or hair on the chest. Then the combination of those will see that actually they have polycystic ovarian syndrome. Yeah, and this way it goes around because people will go to their radiologists or sonographers and they'll be told they have polycystic ovarian syndrome. It's not possible for radiologists from just an ultrasound to tell that somebody has polycystic ovarian syndrome. We can only say somebody has polycystic ovaries, and we need further history, other investigation, especially the male hormones, for us to say that actually somehow somebody has polycystic ovarian syndrome.
So for the layman, for you to have this syndrome, you have to have more than one symptom
Precisely.
that actually speaks to the same. Just one does not hold water.
Correctly said.
Okay, all right.
Yeah.
Now let's get to Beatrice. Maybe she can give us an idea of what it is or how it is to live with PCOS. What was your journey? How did you find out, to start with, that you had PCOS?
My journey started back on 2008 when I tried to conceive the second born. I was unable to conceive. Seen a lot of doctors, they say you have a stress, maybe you have headache, because mostly I had headache, backache, had painful, very painful abdominal pain.
What, during your menstrual cycle? Or
Even
just
the
normal?
normal, yes.
Okay.
So it took me 4 years to conceive. And I conceived naturally. By then, the pressure was too much. So through stress and whatever, I managed to lose weight. Then when I conceived.
You conceived after losing weight?
Yes.
Okay.
Then after second born, I tried for another baby. That is to the end of 2013. I was unable to conceive. So I started trying all means to get a baby. Then so all of a sudden I started feeling unwell. My beard had started growing too big. I have to shave it every day. Then I sent it to generic because my mom has GP, and so I had nothing to worry.
Oh, so your mother had the same symptoms?
Yes.
Okay.
So I fell ill and visited a lot of doctors. Then finally I decided to visit a public hospital where I did a scan and showed that I had a cyst. And then I was referred to a gynecologist. That was 2015, and I started my treatment. In 2015, I did a ovarian drilling. That is after trying all it means to reduce the cyst and to conceive. I was unable to conceive, so we opted for ovarian drilling. And then I continued with my treatment till early this year, when I said, no, this is too much, I have to stop. So I stopped medication, and then I started concentrating on my life. Then on June this year, my husband was retrenched from job. So then I had to the depression. You know, with the PCOS, sometimes I experienced depression.
Okay.
So I started losing then weight due to the family stress and whatever. Then on August, I conceived again.
Yay!
Yeah, now I'm 8 weeks.
Oh, congratulations.
Thank you.
Okay, now, Daktari, there is a clear path in as far as Beatrice's case is concerned. Lose weight, conceive.
Yes.
What's the relation between losing weight and conceiving or not conceiving?
Weight gain, or what I'll say, the overweight or obesity, tend to cause increased insulin resistant fat itself. There's no proper metabolism of the insulin. And when you don't have proper metabolism of insulin, we have what you call insulin resistance, and increases the male hormones that are produced in the female. The very minute amounts of the male hormones which are produced by the ovary, which are good. But when they're produced excessively, then in case of obesity, then they interfere with the formation of the egg folliculogenesis. And that causes actually what she has said is increase of hair growth. Because if you have increased male hormone in the female, then there's hair growth. Just like in the male, what causes the hair growth is the male hormones.
Yes.
And that's where the problem comes in. So if you lose weight, then you reduce insulin resistant. And you reduce the amount of male hormones circulating in the female. And that causes the egg to grow and ovulation to occur. So obesity in itself, even without polycystic ovarian syndrome, may predispose to infertility because of increased male hormones in the female. That's the mechanism. And the first line of management of PCOS is just lifestyle modification. You have to change your diet, you have to exercise, and you have to cut your weight. And if you cut your weight by 10%, then most likely the periods become regular, ovulation occurs, and conception occurs. So that applies to women, even to the male, that actually you can cause poor sperm parameters when you have increased, the male are overweight and they have obesity, because that interferes with the hormonal issues in both the male and the female.
So in the case where, you know, in an African traditional setting where the woman is being told you're the one who cannot conceive, you're the one who can't conceive, such would be something that actually matters when it comes to the guy. Look at the guy and see if maybe he's the one who has the symptoms.
Yes.
And is an impediment to the same. Okay, now, another thing that has come up in as far as Beatrice's story is concerned is that she had the cysts. They tried to get rid of them. She was on treatment. She even got off treatment because she was tired of it. And for her, her solution was just losing the weight. So are you saying it is possible to conceive even if you have polycystic ovaries?
Precisely, it's true. One, if you have polycystic ovaries alone without polycystic ovarian syndrome, the conception will occur. But even if polycystic ovarian syndrome, the first line of management is simply to lose weight. If there's obesity, 10% is not to do surgery. Assuming somebody has a BMI of 30 and you lose weight and your BMI, normal body mass index is less than 25, you get a normal BMI, then conception will occur. And the first of management, that's how I do it. The patient comes in, she has abnormal periods, she cannot conceive, and I make a diagnosis of PCOS. The first thing we're going to tell them, lose weight modification. Then, of course, if the issue is infertility, we are going to put on infertility drugs. They may aid again. In some cases, we may even give the oral drugs we give people with diabetes mellitus, what we call oral hypoglycemics, because we have said the problem when you have obesity is there is increased insulin resistance. And when you give diabetic drugs, they reduce insulin resistance and conception can occur. In the worst cases when it occurs, then what she has said, she went to theater and she was done what you call laparoscopic drilling. Then we can be able to drill. Again, drilling, all these drugs, all this is geared reducing male hormones that is circulating in the female. Even when you do surgery and burn the ovaries, we're just reducing the amount of androgens, the male hormones which are circulating. And in the worst case, sometimes patients may have to go for in vitro fertilization. Again, the results are not very good. The quality of the eggs in polycystic ovarian ovaries, they're not very good. Polycystic ovarian syndrome, they're not very good. So even the results in IVF, they're not very good. But the emphasis actually is lifestyle modification. And again, trying to conceive as early as possible when one realizes he has a problem, because it won't get any better and may continue to go to what we call metabolic syndrome, where it will involve polycystic ovarian syndrome, diabetes mellitus, and actually may end up with heart disease. All of them, the combination, and the condition may get worse.
Okay, Beatrice, back to you. You said your beard was growing and you thought it was normal because your mother used to have facial hair. Now, when you look back in retrospect, did your mother also, struggle in conceiving?
No.
She did not?
No.
So what spoke to the fact that she had facial hair? What was that?
I don't know. So I thought it's genetic.
Yeah.
Yeah.
Is it genetic? What are we seeing here? How is it that the mother had facial hair, no issues with conceiving, the daughter had the same symptoms but had issues with conceiving? What are we looking at here?
We don't know. The PCOS could be genetic component, but most of the time it's just environmental. Because if people, for those who try to get children slightly early and continually, persistently get children, they're more likely just to live normal life. But in the modern society, when people are staying for a long time, and we have said obesity is an issue, then that may contribute. So it's a question of when did the first conception occur, and how soon did the other babies follow. You get it? So because the environment plays a key role.
Yes.
Now in the modern society, we are getting children in the late 20s, in the 30s, and that means these diseases tend to manifest earlier, and by the time somebody trying to conceive, they have already manifested and maybe gotten worse.
For those that are joining us now, just a brief overview. It is a hormonal disorder causing enlarged ovaries with small cysts on the outer edges. Cause not very clear, but it's attributed to both genetic and environmental factors. Symptoms: menstrual irregularity, excess hair growth, acne, obesity, and its treatment methods vary, and we'll be talking to the doctor, of course, the gynecologist, Mr. Wanyoike, and Beatrice, who is living with PCOS. I mean, Dr. Or maybe let me start with Beatrice, because that's where we were before we went to the coast. Beatrice, you were saying there was somebody who was asking, does PCOS affect normal pregnancy, normal childbirth, and a healthy baby?
It doesn't. And my second born, I had the smoothest pregnancy, I can say. No morning sickness, nothing until 8th month, when I experienced severe yeast infection.
Okay.
Till the date of delivery, I struggled with it for 7 days before the delivery. But this pregnancy was smooth, gave birth to a healthy baby.
Yes.
A very genius girl.
Okay.
Yeah.
All right. So there is hope in having, conceiving and actually having a normal pregnancy. And this is something that has also been alluded to somebody who's been following the conversation. And they're saying there is hope for those living with PCOS because his wife actually lived with it, and now they have a bouncing baby boy. That is actually Stan K, who says, my wife was diagnosed with PCOS, but she was able to conceive, and now we have a 7-month baby girl thanks to the assistance of a gynecologist. Now, Dr. that we've alleviated the fear that there could be an issue or affect the birth and the pregnancy of children actually born out of people that are born from people living with PCOS. But the question here is, when it comes to the symptoms, some of those that she actually touched on is the fact that she deals with depression. Is that something that has to do with the hormonal imbalance, or is it just generally the fact that you have to live with this syndrome that you do not understand?
No, it's not because of the hormonal imbalance. The depression is a consequence of the manifestation of polycystic ovarian syndrome. One, it causes infertility. It's a major issue in polycystic ovarian syndrome. So there's that frustration of not able to conceive. Two, there's the increase in obesity, and we have said hirsutism, increase in hair. There's acne, and all those factors actually cause depression. There's that issue of low self-esteem. That's what causes the depression. So it's not the hormonal manifestation, but actually it is actually the manifestation of the disease itself that causes one to feel depressed and worthless. Especially, this also will apply to those people who are not able to conceive. In infertility, they get really stressed, and some of them get depressed.
Okay. Now, Beatrice, you had a question to the doctor, in as far as you having your ovarian drilling, it leading to regular menses, but you still did not conceive.
Yeah.
Dr. What was the issue here? Shouldn't one lead to another?
Yeah, precisely. When you have polycystic ovarian syndrome and ovarian drilling is done, actually almost 80–90% of the couples will conceive, but sometimes that does not occur. The biggest challenge we have with polycystic ovarian syndrome also is the quality of the oocyte. The quality of the egg is affected to some extent. So the conception may be still slightly difficult. Two, there's slightly increase in chances of having a miscarriage. Some people may not realize if the miscarriage occurs very early. The pregnancy will be normal if it does occur. So those are the factors which can affect actually conception. That actually sometimes everything is functioning well, but that quality of the egg, the oocyte, is not very good. So fertilization may not occur, and if fertilization occurs, the quality of the embryo may not be as good as somebody who doesn't have polycystic ovarian syndrome. And that applies again to even those who undergo in vitro fertilization, IVF, and have polycystic ovarian syndrome. The chances of conception is less than people who do not have the polycystic ovarian syndrome.
Now, Beatrice, living with PCOS and having all the symptoms, hair growth, trying to conceive, and that was hard for you, but at least the losing weight helped you conceive. Did you have a support system in all this? Did the people around you understand what you had to deal with or what you have to deal with?
The only person can say understand me is my mom. Even my husband, I've tried to explain to him, today I'm not feeling this, today I have abdominal pain. So the only person who can understand me is my mom, very clearly. But sometimes you may find yourself crying out of nothing. Even a small thing in the house, a baby can make you cry. Yeah.
Is that the depression manifesting?
I think.
Yeah. Okay.
So it tends to, many people do not understand what we go through. Because for me, by then I was a housewife, so I had no job. The bill is huge, especially managing PCOS is not an easy thing. I think even the pressure from the both families, you know, you get married, you just have one daughter, you have no other child, then you take long to conceive. So you try to tell them, maybe I've gone down everything I have done ECG, all medical tests, you have given Chromid and whatever to boost the fertility, but nothing happened. So it turned that sometimes you are blamed.
Yes.
And it came to a point, I even moved out of my house because the pressure was too much. That when I conceived the second born. Yeah.
Okay.
And it was I can say the pregnancy was very smooth. Apart from the 8 months where I experienced bleeding, in case I do some house chores and whatever, I had to experience bleeding. But it was contained and the yeast.
The infection.
Yeah.
Oh, okay, Dr. She mentioned or touched on the fact that this is a costly affair, managing PCOS. Talk to us about that and what the options are.
The options of treating polycystic ovarian syndrome, sometimes it's just the symptoms that we treat, because some will just manifest with acne, and we are going to address the issue of acne, which can be treated with drugs. Sometimes manifestation may be hirsutism, increased hair growth. It can't be treated medically. Either you have to shave, you have to use the depilatory creams, or you may have to undergo laser treatment. So that can be quite frustrating because, again, laser treatment is very, very expensive. But most of the people who manifest with polycystic ovarian syndrome, the problem is infertility. They're not able to conceive. And that's why they present to the doctor most of the time. And we have said before, if the body mass index, they have overweight or obesity, then losing weight actually can cause conception to occur. Like she has said before, she just lost weight and she conceived, as we have said. Because when you lose weight, the male hormones, the androgens, tend to go down. If that can't happen again, we can give fertility drugs, because the problem is the egg is not coming out. The mothers are not ovulating. Those women who have polycystic ovarian syndrome are not ovulating. The egg is not coming out. So giving fertility drugs like clomiphene or letrozole do improve on that. And again, we have said that those who are obese, insulin is a factor, what you call insulin resistant. So sometimes we give actually diabetic drugs, oral hypoglycemic, they do help in that improving the environment, and conception can occur. If the worst comes the worst, then again we can do surgery, what we call laparoscopic surgery, where we drill the ovaries, we puncture holes on the ovaries. Puncturing holes is just to cause the ovary tissue, we burn ovarian tissue to reduce the amount of androgens, the male hormones being produced by the ovary. That's what we actually do. That becomes very expensive, especially laparoscopy, because when you look at this country, the public hospitals which can perform laparoscopic surgery, I think is just Kenyatta National Hospital and Moi Eldoret, a bit of Kisumu and maybe Mombasa. The other hospitals don't do. So you can imagine those people who are in the peripheral areas, they have to be referred to these hospitals if they're relying on the public hospitals. So majority of the people have to rely on private hospitals, and that becomes very, very expensive. Yeah. So those are the challenges we do face. that consultation, regular consultation, medication, cumulatively becomes very, very expensive.
Okay, and
maybe to add on that, I would just like to say that when you go to the developed world, and maybe you're heading there, you have PCOS societies where the professionals come together and see how can they tackle this issue of polycystic ovarian syndrome society. We don't have that, maybe sooner or later. And of course, we have PCOS support groups. Like you can see the frustrations she undergone. The spouses, the partners, the societies don't understand what people are going. So sometimes we have support group and people come together and support each other, and they go with the spouses and the family, so they realize it's not that particular person to blame, it's just the condition itself which needs just to be addressed. Yeah.
Again, information is power.
Yes.
For you, Beatrice, are you part of the support group, people who've walked with you because they understand, they've had similar experiences, or, you know, something like that?
No, currently we don't have one. But we have Facebook groups where we share our ideas, and a WhatsApp group.
Okay.
We encourage each other. And I think through that group, sometimes you get solace there.
Yeah.
And comfort. And maybe short of ideas, if you are going something and you can't access the doctor, then we ask each other in the Facebook or the WhatsApp group.
Yeah.
Yeah.
And has it helped in getting people enlightened and also to know who to go to in case you're dealing with something?
Yes, it has. Now the major problem is not the people with PCOS. It's the people around the people with PCOS.
Aha.
Yes.
Okay.
Because I have PCOS, I have all symptoms and whatever, but you, as my partner, you can't understand what I'm going through.
Yeah.
So you get some women are being thrown out of the house just because the partner does not understand what the woman is going through.
Yeah.
So it tends to have that. The group helps a lot. But you hear many women complaining, I'm being out of my marriage because of this. So the depression has increased to women.
Yes.
Yes, and I think the awareness should be put.
Okay, she raises a good point. It's not about people living with the PCOS, it's the people around them.
Yes.
I mean, as a doctor, are there things that maybe you're putting together to ensure that there's sensitization around PCOS?
I think the most critical, that creating awareness, we have not been very effective in this country. One of the biggest challenges we have, especially in Africa, is the key manifestation of polycystic ovarian syndrome. Why people complain is infertility. Funding infertility has been a big challenge because most of the programs in the government public sector are funded by donors. When you talk to the donors about funding infertility, they say you don't have a problem with fertility, you have a problem actually of production. So you don't get any funding. When we go to the government, the infertility does not cause pain, it does not hurt, although it has psychological trauma.
Yes.
The government doesn't fund. We have tried in Kenyatta National Hospital to set up an infertility center, Kenyatta National Hospital. We have not received support at all, and to have an IVF group. That's where the problem comes in, that we don't have any national organization or any support to support infertility. And 90% of the patients who cannot ovulate actually have PCOS.
Okay.
You see, so it's a major issue, so it can be addressed through that forum. However, what we normally encourage as doctors is a patient presents to us and we discover PCOS, we like to approach it from a couple point of view, like the husband to come there and we explain the problem, and we try to support them so as they can be able to understand, especially when it entails infertility.
Okay, now, Dr. This is a question that is directed to you. When it comes to miscarriages, if somebody has had several of them, would it be time for them to see a PCOS specialist?
There are many factors which can cause recurrent miscarriages, but PCOS can be one of them. Actually, it may be able to cause because of the hormonal issues. When conception occurs, there's a hormone called progesterone, which is produced by the ovary, by corpus luteum. The formation of the corpus luteum tends to be poor in the patient who have PCOSs. So they should see a gynecologist, actually, who is going to evaluate all the other factors, because the other factors which can be able to can cause miscarriages. So it's PCOS, then it's very manageable. But however, if I get a patient who has PCOS and she conceives either naturally or through fertility drugs, then we give them the first 3 months, we are going to give them support, hormonal support to make sure miscarriage does not occur.
Okay, now Beatrice mentioned the fact that she was misdiagnosed a lot before she even understood what it is she had to live with. Are all gynecologists equipped enough to understand when to look out for PCOS?
No, I would say yes and no, because I myself am a fertility specialist with a master's from University of Leeds, UK. That actually PCOS would entail management of infertility, which is a sub-speciality. So there's a general gynecology, then you're going to specialize in infertility, which will entail PCOS. So it's not true that all of gynecology entail. However, because of the shortage of fertility specialists in this country, it's still advisable for somebody to see a gynecologist. There are very few fertility specialists here.
Okay. Now, I am informed that we have a caller who would like to chime in into the conversation or even ask a question. Remember, if you can reach us, if you want to talk to us, you can reach us through the numbers on your screen. Jackie from Homa Bay, what is your question?
I had a problem. Yeah, it's a case I've been having regular, menstruation tangu inakwanga not stable as such. You know? Not stable as such. So there is a day I went to Homa Bay. We have a gynecologist called Mr. Ondigo. When I went there, I went over test or this is called the ultrasound. They told me that thing is okay. And then there is a second test nilienda after menstruation yangu. So after that, they gave me some medicines called Lastrozole. Of course, I was supposed to take them after the second day after my menstruation. The first mini goes like that, and another second menstruation come. I was supposed to take for is the second day of my menstruation. So I've not seen anything coming as if I can conceive. So my question was, should I continue going for this dose or can I stop taking it and look for another drug?
Okay. Thank you, Jackie, for your question. And of course, if you have any questions to the doctor or even to Beatrice, you can reach us through the numbers on your screen. Daktari, you've had her question. What would be your advice?
My advice is infertility is a very complex condition because it can be multifactorial. It doesn't mean that someone who has polycystic ovarian syndrome does not have another condition which can cause infertility. It does not mean man does not have a problem. We see actually, like in the developed world, the issue of the infertility is 50% male, 50% female. In our society, it tends to be slightly female because of the tubal factors. So she needs proper evaluation. She needs to evaluate, especially tubal factors, that the tube's blocked. Because saying just PCOS is not alone. You need to evaluate in totality what is causing that infertility. You need to evaluate whether there's a tubal blockage, whether there are uterine fibroids, whether it's a hormonal profile, and see what is the problem, and analyze the male at the same time before now you make the decision what to do. Yeah, letrozole is a standard drug if it's PCOS which is causing. Again, conception does not occur in the first cycle. You need to take this medication for at least 6 months to say it has failed. So if everything was done right and she's taken this drug 1 or 2 cycles, she needs to do it for 6 cycles before she says it has failed.
Okay.
Yeah.
All right. Now, a question to Beatrice. You spoke about losing weight and that's when you successfully conceived. Now, somebody is saying they've been struggling with the same. They try to lose the weight, but they cannot maintain the weight where it's supposed to be. So what have you done or what has worked for you?
I can't say because the first month, the first pregnancy, which is the second one, I think I lost weight. Then it took a duration of 4 months before I conceived. Then this came as a miracle, I can't say.
Yeah.
Because it came once I lost weight, but I managed to lose 10 kg. That was June this year, and that's when I conceived. I think maintaining the weight is a challenge. Because for me, I don't reduce weight. I reduce the size of the body. But the weight remains. Yeah.
Okay. All right. Daktari, speak on that issue. Is the losing weight part and parcel of everything that comes with PCOS, or is this varying from one person to another due to genetic predisposition?
It will vary from one individual to the other one. And as you have said, the PCOS is caused by many factors. It's not only just obesity. So it could be other factors, could be genetic factors.
Yes.
And losing weight again, it's not always easy, first of all. It's quite difficult, and it will depend from one individual to the other one. Some people may have very difficult in losing weight because constitution is the way their bodies are, is their genetic makeup, so it becomes very difficult. And those are the people now will, on top of that, put them on medical treatment to cause the ovulation to occur or to treat the PCOS.
Okay, and another question to Dr. Does contraception contribute to PCOS?
No, contraception does not contribute to PCOS.
I think the question is coming from the fact that you said if the ovaries are not producing ovaries as often as they should, it should be an issue going forward in as far as how your body translates it. So is there any relation?
No, the contraceptives do not cause PCOS to occur. If anything, we can use the oral contraceptive pills to regulate the periods if it's very, very mild. Because when you give oral contraceptives, they consist actually of the hormone called estrogen and progesterone. And then they tend to reduce the amount of the estrogens, progesterone produced by the body, and also the male hormones which is produced by the body. So actually they can, one, regulate your periods, because people who end up with the endometrial cancer is because they don't get their periods. So if you get your periods every month, you're not going to get endometrial carcinoma cancer. So the pills can be used for mild PCOS just to regulate your periods, especially in those who do not want to conceive. Yeah, but it doesn't cause PCOS to occur.
And another question, do we have more cases of PCOS now than there was before?
Yes, indeed we do have, because we have said PCOS can be genetic or can be environmental. What is happening to our weight? We are getting more and more fat, we are getting more obese, and we say obesity is a factor in our society. In earlier days, we used to be much smaller. So there's that issue of our diet, our lifestyle contributing to obesity, which eventually may contribute to PCOS. The female body is geared towards the reproduction, to having children. That's how it is meant to be. So for those who get children early and get slightly more children, they're less likely to get PCOS, because that's how the body is supposed to function.
Wait, say that again. The earlier you get a child and the more you get,
they're less likely to get PCOS. You get it? Because that's the hormonal issues tend to be more corrected when you conceive. You've had this issue notion that if your periods are very regular or the periods are very painful, and if you get a child, then the periods may become more regular and less painful. That is absolutely true, because there's hormonal correction itself. The body tends to correct itself.
Okay, now in the case of Beatrice, her firstborn she had when she was 17. Then why didn't it work for her?
You see, the polycystic ovarian syndrome is multifactorial.
Yes.
It does not apply. It's not a rule that what is applied to all doesn't apply to all. So it will depend from one individual to the other one.
Okay, now Beatrice, I guess the question here would be, when it comes to the cost of dealing with treating PCOS, how have you been able to deal with it? I mean, it is quite a burden on you.
It is quite, and very challenging, because most insurance does not cover. But the good thing, I had a company doctor where my husband used to work. Before we stopped, it came to a point now he said, no, the insurance cannot cover here. So here you have to pay cash, because now the insurance does not cover infertility. Now we have dealt with PCOS. Now the cyst, it has reduced to size, to the normal size. But now if you want a baby, you have to pay cash.
Yeah.
So we chipped in for 1 month, then it came to a point I was not unable to afford. So we withdrew the treatment, because medicine, you have to go for appointment at least twice per month, the diet, so it became costly for me.
Okay. Now, Dr. she touches on something very vital here. You touched on the fact that there are very few hospitals that can help along with the process. But then again, if you have an insurance card and it doesn't really help you much, I mean, what would be some of the solutions maybe that can be put in place so that people can get the treatment they need?
I think the biggest challenge you have in this country, the insurance do not cover infertility at all, aspects that we need. NHIF again, depends on what cover you have. They'll just cover the bed charges. They're not going to cover the daily consultations. So actually the frustration sets in that it should be a policy that these people should be incorporated in either insurance cover, especially when you're talking about having a national insurance cover. This should be incorporated into that. And maybe NHIF should be incorporated actually to see how they can assist these people. Because the treatment is very expensive, as she has said. It may entail surgery, it may require admission to the hospital, and the worst case, it may require actually in vitro fertilization, which costs 500,000. Wow. And then what you have said before is getting foundations which can be able to support, because even in Europe, treating infertility and America is very expensive, but there are foundations which help. You have fertility foundations which tend to help, and some of them are actually government foundations, and other they're private foundations, and organization which actually can help this one. That's the way we can approach this condition.
I know you said that there is no cure to PCOS.
No, there is no cure to PCOS.
Is there any chance that the syndrome can go away on its own?
Yes.
How?
We don't know. Because some people will present with the PCOS and it just regress on its own. It can't regress on its own without even without any pregnancy, it just regress on its own. We don't know its cause of this disease, and we don't understand it yet. That's what the challenge which comes. Even making diagnosis, when you come to the international level, there are various organizations who make different criteria for diagnosis of this disease. So actually it can just go and regress on its own without any medical intervention. And
is there a chance you can live with PCOS without knowing you have it?
Yeah, you can live with PCOS, especially when it's in a mild form, because what will happen is somebody will just keep periods. 2 to 3 months you don't get your periods, and they come again. In fact, most people realize they have PCOS when they come to conception. They cannot conceive. That's the one that, why aren't we conceiving? Yeah. And you come when the doctor realizes that actually when all the workup is done for infertility, you realize the problem is PCOS. Others, for those who don't want to conceive, they can live without any disease. But the problem is the progression of the disease. We know this disease can progress into diabetes mellitus, frank diabetes mellitus, can progress into heart disease, can progress into endometrial carcinoma, or it can cause what you call metabolic syndrome, where you have actually the heart disease and the diabetes mellitus and polycystic ovarian syndrome. Yeah, and that's therefore indirectly. Normally PCOS will not kill, but when it goes to diabetes and goes into ischemic, goes to heart disease, then it can end up killing. Not directly, but indirectly.
Wow. All right. Maybe in closing, Beatrice, as somebody who's had to live with this syndrome and, the challenges that come with it and even the treatment of the same, what would be the clarion call, maybe to policymakers, to doctors, insurance companies, people who live around people with PCOS? What's your clarion call to them?
My call would be for the society and the government to consider the patients, because without insurance, without cash, because no insurance cannot cover. So at least they include that in the NHIF, because a common mwananchi can afford NHIF. So you find many women can't assess. For me, I was unable and they overcame it. But there are some people who are unable to assess, because seeing Dr. Wanyoike is not 1,000. So I can't even afford my fare from my place to his place. So how? But at least with an insurance, NHF, you can go to a private, the nearest government hospital, then they can refer the patient from there. And with a referral letter, patient can assess easily.
Okay.
Then another thing is the society to understand the patient. Before you judge somebody, please try to learn to see what is she going through. Many women are committing suicide, like me, I tried committing suicide.
Oh.
Because the pressure is too much, depression hits, the medical bills, sometimes you look at your medicine, you have to swallow all this, and you are not sick. So you say, life is too short, you'd rather die than suffer. Yeah.
It is a rough road to
Yeah.
walk on. Okay, Dr. your parting words for something that clearly is very important, something that needs to be looked into, and now with health being part of the pillars of the Big Four agenda for the government, and this being a devolved unit, what is your parting shot?
I think the first message actually to the women or to the ladies is actually menses. Regular menses shows your reproductive system is very good.
Yeah.
If you're not getting regular menses for any reason, you stay 2 to 3 months, you don't get your periods. Sometimes you stay 6 months, you're not getting your periods, or you're getting periods more frequently, 2 or 3 times in a month. It's a sign something is not right somewhere. You need to see a doctor. But we take it for granted because you're not sick. As she has said, you're not absolutely not sick, but you're not getting your periods for 3 months. Then you stay another 3 months. But it's a sign your reproductive system has a problem, either at the ovary level, either at the uterus level, or actually could be sometimes in the what you call hypothalamus pituitary, in the brain level. So you need to see a doctor, the message. Now, some of the diseases, when you intervene early, they're correctable. But if you wait for too long, it's not possible to correct it, you know. Like PCOS, if we realize much early, we can advise you modify your lifestyle. Try and get your children early because this condition may get worse. That's one to the general public. And of course, what she has said is when infertility occurs, is a couple issue, is not a female issue. As I've said, like in the developed world, 50% of the couple in 50% of the couples who cannot conceive, the man who has a problem. So infertility is a couple problem and it's a society problem, especially in society because we love to have children and these children take care of us. And 2 is at the government level. I am a senior lecturer at the University of Nairobi. I work in Kenyatta National Hospital. We have actually urged the government to set up an infertility center, the public ones, and nobody is really bothered because infertility does not pain, it's not a major national issue. But it's very stressful and has psychological trauma. And you have said people actually try to commit suicide. You remember the case which we had in Machakos where somebody's hands was chopped. Is the major problem. We don't have clear data, but I would say almost 15 to 20% of the couples you see in Kenya have a problem in fertility. We are talking about for every 5 people you see, most likely 1 couple has a problem in fertility. But the problem, you don't get sick, it doesn't hurt, it doesn't pain. You know, we ignore it and we just assume people don't want to have children. You get the point? Yeah. So at the national level, we need, especially in the Kenyatta, we need to set up an infertility center which will incorporate an IVF. Because the ultimate treatment of the PCOS, if it doesn't work in fertility, is to in vitro fertilization. Right now, all the centers which do in vitro fertilization are private. There's not even a single one which is public.
That is sad.
It's a sad affair. And on the other hand, you go in Uganda, they're setting up a public IVF center. Zambia has. And those countries have less gross domestic product than this country. Yeah. Even small country like Eritrea is trying to set one. But we have tried to address this. The government or the relevant authority don't want to get to the root of the problem. That there's a problem here called infertility.
All right. Thank you so much, Dr. Wanyoike Gichuhi, a gynecologist and fertility expert. Beatrice Kathure, who is living with PCOS. Thank you for your time. And clearly, as stated, infertility is an issue in this country. Policymakers, those in the healthcare, stakeholders need to understand that there needs to be resources set aside to help those that have to live with some of these challenges and also invest in the same. Well, that has been a conversation around Polycystic Ovary Syndrome. PCOS is what we call it. And of course, I can see that conversation going on Twitter. Please, let's continue to engage. If you'd like to reach out to any of our panelists, you can. And you can let me know on Twitter at Gladys _Gachanja at NTV Kenya.